I'm sorry, Dr. Yaffe, but you're going to have to come back up here. I always refer to the medical experts.
You know, I think a lot of people think that testing is going to really solve the whole problem, and it isn't. It's one component of a response. If you test somebody today, you only know if they're infected today. And in fact, if you're testing in a population that doesn't have very much COVID, you'll get false positives almost half the time. That is, the person actually doesn't have COVID, they have something else, they may have nothing. So it will just complicate the picture. I just say whatever they write down for me.
That's why you're guessing.
Sure. Could I go out there and be the only politician in the entire country, including the Prime Minister, all premiers, every single mayor, because I've talked to the vast majority of them, and say, okay, docs, I'm not a medical professional, but I'm going to disagree with you. When I said I'm going to follow their direction on health advice right from day one. And then if I did that, they could slap a Section 22 down, and it's just friction. You know, I'm going to stick with what I've done right from the beginning. I'm going to stick with health and science and work with them collaboratively. But I'm going to be very frank. There's no politician in this country who's going to disagree with their chief medical officer. They just aren't going to do it. They might as well throw a rope around their neck and jump off a bridge. They're done. I'm telling you the facts. It's very simple. I respect all the medical officers and all the docs that have been working their back off, and I will always listen to the chief medical officer, his team. Very, very simple. Because they're the professionals when it comes to healthcare. I'm not.
I just say whatever they write down for me.
That's why you're guessing.
There was a lot of discussion and interesting comments made by the Chief Medical Officer of Health last week about proof of vaccine. So I'm asking, would you allow employers or schools or other organizations like long-term care homes to demand proof of vaccine, or will it be completely optional like the flu shot?
Well, right now it's optional. Constitutionally, I don't think we can force every single person to take it. And I just don't believe in forcing people to take this. What I do believe in encouraging everyone possible out there to get a vaccination shot. It's going to protect all of us, but it's also going to get the economy moving forward. It's going to protect our healthcare system. It's going to protect our education system. So I highly recommend that people take the vaccine. I'll pass it to the Minister of Health.
I just say whatever they write down for me.
That's why you're guessing.
Right now, all gatherings are off the table. We're all in that place where any time we get together with more than our household members or our families, we're putting ourselves at risk. And particularly if we're going to be in contact with people who are older or more likely to have severe illness. So when I talk about 50, that's for mass gatherings, for events, for things that are happening in the community. And I am reticent to go, none of these are based on scientific evidence. There's some evidence in that some modeling that Alberta has done that shows that 18, if you have less than 18, your probability of having a case may be less, and so they went with 15. But the bottom line is, none of this really is based on science.
I just say whatever they write down for me.
That's why you're guessing.
This here is a specific situation, but our orders right from the very first public health order we wrote does not apply to governments.